Welcome to the Safety Stand Down, and thank you for participating by taking 10 minutes to review COVID-19 prevention and workplace safety practices. The Maryland Building Industry Association remains focused on the health and safety of workers on building sites in order to flatten the curve and spread of the coronavirus. What is COVID-19? The novel coronavirus, COVID-19, is one of 7 types of known human coronaviruses. COVID-19, like MERS and SARS coronaviruses, likely evolved from a virus previously found in animals. The remaining known coronaviruses cause a significant percentage of colds in adults and children, and these are not a serious threat for otherwise healthy adults. Patients with confirmed COVID-19 infection have reportedly had mild to severe respiratory illness with symptoms such as fever, cold, and shortness of breath. According to the U.S. Department of Health and Human Services, Centers for Disease Control and Prevention, otherwise known as the CDC, Chinese authorities identified an outbreak caused by a novel or new coronavirus. This virus can cause mild to severe respiratory illness. The outbreak began in Wuhan, China, and has spread to a growing number of other countries, including the United States. How is COVID-19 spread? COVID-19, like other viruses, can spread between people. Infected people can spread COVID-19 through their respiratory secretions, especially when they cough or sneeze. According to the CDC, spread from person to person is more likely among close contact, about 6 feet. Person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes. Like how influenza or other respiratory pathogens spread, these droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is currently unclear if a person can get COVID by touching a surface or an object that has the virus on it and then touching their own mouth, nose, or eyes. In assessing potential hazards, employers should consider whether their workers may encounter someone infected with COVID-19 in the course of their duties. Employers should also determine if workers could be exposed to environments or materials contaminated with the virus. Depending on the work setting, employers may also rely on identification of sick individuals who have signs and symptoms and/or a history of travel to COVID-19 affected areas that indicate a potential infection with the virus, in order to help identify exposure risks for workers and implement appropriate control measures. There is much more to learn about transmittability, severity, and other features associated with COVID-19, and investigations are ongoing. Worker responsibilities. Frequently wash your hands with soap and water for at least 20 seconds. When soap and running water are unavailable, please use an alcohol-based hand rub with at least 60% alcohol. Always wash hands that are visibly soiled. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Employees who have symptoms, i.e. fever, cough, shortness of breath, should notify their supervisor and stay home. Don't go to work. Sick employees should follow CDC recommended steps. Employees should not return to work until the criteria to discontinue home isolation are met, in consultation with healthcare providers and state and local health departments. General job site and office practices. Clean and disinfect frequently touched objects and surfaces such as workstations, keyboards, telephones, handrails, and doorknobs. Dirty surfaces can be cleaned with soap and water prior to disinfection. To disinfect, use products that meet EPA criteria for use against the cause of COVID-19 and are appropriate for the surface. Avoid using other employees' phones, desks, and offices, or other work tools and equipment when possible. If necessary, clean and disinfect them before and after each use. Clean and disinfect frequently used tools and equipment on a regular basis. This includes other elements of the job site where possible. Employees should regularly do the same in their assigned work areas. Clean shared spaces such as trailers, break rooms, and lunchrooms at least once a day. Disinfect shared surfaces, door handles, machinery, controls on a regular basis. Avoid sharing tools with coworkers. If you can't avoid it, make sure to disinfect each item before and after each use. Arrange for any portable job site toilets to be cleaned by the leasing company at least twice a week and be disinfected on the inside. Any trash collection from job sites must be changed frequently by someone wearing gloves. In addition to regular PPE For workers engaged in various tasks, fall protection, hard hats, hearing protection, employers will also provide gloves, and gloves should be worn at all times while on site. The type of gloves should be appropriate to the task. If gloves are not typically required for the task, then any type of glove is acceptable, including the use of latex. Gloves should not be shared if at all possible. And eye protection. Eye protection should be worn at all times while on the job site. Please continue to stay safe and take extra precautions as we flatten the curve. This is a challenging time, but I promise we'll get through this together.